Hi, my name is Jennifer Short, and this is my video presentation, my final project for COVID-19. This is my title page, How COVID-19 has Affected Kentucky's Vulnerable Residents. I wanted to answer a few questions about Kentucky's most vulnerable, and these are people in long-term care centers, nursing homes, the correctional population, and other state-run hospitals and facilities. I want to know what kind of numbers affected their facilities and how those numbers affected the state, the county numbers. This is an overview of the total counts in the state. 7,688 residents have tested positive, 344 have died since the onset. The Kentucky first case was reported to the public on March 6th. As you can see across the state, it's pretty widespread. I don't think there's as many confirmed or have died in eastern Kentucky, and that's partly attributed to testing in that part of the state. My next slide is an overview of the counties and their populations, and they're confirmed. Of course, Jefferson County is the most highly populated county in the state. They have 767,154 residents. They've got 1,713 confirmed. If you scroll down, Fayette County has had 409 with half the population. So they have not had as high a percentage of their population affected. Kenton, Warren, Boone, Hopkins, they've all had high numbers. See, Davies has had high numbers. Those are more populated. Two counties in particular I want to talk about report large percentages of their population that tested positive or died compared to the rest of the state. These counties are Muhlenberg and Butler. There's facilities that are situated in these counties that have made these counties' numbers jump. This is a timeline of Governor Beshear's orders, recommendations, and things for the Department of Corrections only. On March 10th, 4 days after the first case hit Kentucky or was reported, he issued an order to close all the state prisons to visitors. My prison actually closed about a week before that. We had several inmates in the prison test positive for flu. So they stopped visitation the weekend before because of the flu, and then they just held it closed after that, because of the COVID. So, and these other dates are, the governor's orders to commute additional, inmates commuted their sentences to get them out of the population. These were nonviolent, non-sexual offenses. So that's a timeline of that. And then on April 5th, they talk about testing at Green River Correctional Complex. So, and that is in Muhlenberg. Muhlenberg County houses Green River Correctional Complex, GRCC. And they have had 353, I think the actual number is 354 today, 50 staff and 2 inmate deaths so far. So Green River was actually overrun with this. That's pretty much half of their inmate population was tested positive. Muhlenberg County had a total of 457. 353 of these were from the prison. So 77% can be attributed to the prison population. And this is the county that made the national news for having, I think 2 weeks ago, having the highest jump in the percentage in the nation within a week. That was Muhlenberg. And I read news reports that some of the community were not very happy with that news report because it didn't state that that was in the community. It stated, it didn't state that. It stated, it should have said it was in the prison population, just housed in their county. The only other prison who's had any, Roeder Correctional, not far from my prison, they had one inmate positive and one staff positive. The OC has done a really good job about locking down visitors. Now vendors are not allowed in, so they are taking a lot of steps to keep this out of their prisons, because these people are vulnerable. They can't leave, so. And this talks about Green River a little more in the national media case, and I actually have the link in my my resources page, my references to that story. This is a timeline of Governor Beshear's orders pertaining to long-term care. This is when he started limiting visits to the facilities. On April 10th, the task force was convened aimed at addressing the concerns of Kentucky's long-term care facilities. This is a little bit better view of the county's long-term care numbers. Jefferson County, of course, large population. They have many long-term care facilities. I didn't put those in this, but they have 278 cases in their long-term care centers. Butler County, 89 cases, and that is one long-term care center. It's not several, that's just one. So that's very sad. And of course, the other counties. 41 of Kentucky's 120 counties have reported cases in 90 of their long-term care facilities. Of course, Butler County, I said, has the highest percentage. That's where that one facility is. 1.57% of their population has been affected. They only have 12,745 people in their county. So 200 people have been confirmed. And of course, like I said, 89 are in one facility. I did want to put in here that the Office of Inspector General oversees standards for long-term care facilities and all the other healthcare facilities in the state. They've kind of laxed off doing their surveys of these facilities, and they are now doing COVID inspections. The results of these inspections can be found here on this link. They have inspected 44 long-term facilities, long-term care. If you read the results of these surveys, it's very interesting. OIG surveys, but they also educate. So that's pretty interesting. This is a drill down of the counties and what I've talked about. So Butler County has the highest percentage of their population affected by COVID, and they only have 12,000 residents in the county. Muhlenberg is next. They have 31,000 residents in the county, and they have a next highest percent of their population affected. Here's Jefferson County. They have the highest confirmed number of COVID-affected residents, but with such a high number in their population, the percentage is much lower. These are the other state-run facilities. The child welfare, the one that's actually showing on my graph is Maryhurst. It's actually a girls' foster home. They have 11 confirmed residents and 15 confirmed staff. Let's see. And the ICF-IID, Intermediate Care Facility for Intellectual Disabilities, they have some high numbers, and one in particular, Hazelwood in Jefferson County, they have 19 confirmed cases. So these people live in dorms, and they've actually assigned 2 whole dorms to house the people who have tested positive for COVID. And then they have one backup, if they have overflow. But a lot of these individuals in this facility have severe mental retardation, intellectual disability. So that is very sad. This is one of our sister facilities. Let's see, in another psychiatric hospital, there's 4 in the state. I have 1. And this one is Western State. They have had 14 positive patients, 2 patient deaths, and 31 positive staff. The state hospitals, they have weekly teleconferencing meetings, and they all try and follow the same policies and procedures, pertaining. So I don't know how many of Western states have recovered now. So, okay. And this is a timeline. It's talking about the testing, and the governor's announcements about testing procedures, testing facilities opening up, the testing capability in Kentucky. The good news is there's more and more testing locations in the state. I had a picture. I couldn't get it to get in. I couldn't put it in the story, but it shows testing facilities over the whole state. So that's a good thing. There are now 141 testing centers open in Kentucky. There have been 110 people tested and 68,000 tested positive. The good news is we've had 2,546 recovered. We've had 321 deaths, but more and more testing is taking place. It's getting easier to get done. It's getting faster to get the results. There's drive-thrus. It's getting much better. My roundup, the more testing that is done, and now with the announcement on April 29th for things to be opening up more in the state, our numbers are going to increase. So I think Governor Beshear and the citizens of Kentucky have done a great job in attempting to contain the virus. We have learned a lot, since March 6th. And, all the things that are being recommended for everybody to do, the hand hygiene, social distancing. Next weekend is 10 or less for the holiday weekend, for any kind of gatherings, wearing masks. All those things are going to keep the vulnerable in Kentucky safer. All the people that are working in all these facilities, prisons, all these facilities, they're essential employees. So the better we do taking care of each other, the less chance that we are of taking it into one of these facilities. When I go out in public, I'm safe. I try to be as safe as possible. I try to take care of myself because I have to go to work. And what I take into the prison, what I take into my hospital, affects our patients. And that's what makes them vulnerable, because if anything, any virus, anything, even the flu gets in the facility, it's because a staff or a visitor took it in. So we have to think about things like that. This is my references. I had a difficult time trying to pull out of the COVID story, the downloaded workbook that was given to me. I found a lot of population data, things like that. But I had to rely on, because of what my interest was, the state websites. So that's what I did. I made my own spreadsheets and pulled them in as new data, a new data source into the workbooks, and I built it from there. So they had daily updates, and I did that every day. So that is my presentation. Thank you.